the color pink, don't you? Look at this. This is great. We are here and we are standing up for women's rights. We are standing up for women's health because we know it matters. And we've made a choice. We are here, legislators together with people across New Jersey. And a shout out to the men that are here, men to support this case. Yesterday was Father's Day. And you know, the men are here and there have been great support from the men in the legislature, those that are here, others that couldn't, especially Pat Dognan, who's been with us every step of the way. And I want to say that that's because, more than anybody, the men understand that in a family, when mama's happy, everybody's happy. And when mama's healthy, everybody's healthy. That's what this is about. This is about the health of women and families. And we've made our choice to stand for women and stand for women's health. And sadly, in the front office, we have a governor who, with the support of the Republican members of his legislature, do not agree with that. They have made their choices, and their choice has been to turn their backs on the women of the state of New Jersey. They have turned their backs on us having access to health care because they have chosen, the choice that they've made has been to stand with the millionaires in this state and the big business in this state, eliminating health care for working and poor women, because we know that the wealthy will always be able to afford access. They will always get what they need when they need it. This is about the middle class and the working people of this state. I am so proud to stand here with all of you. We've gathered to carry on this fight. It started a year ago. We passed the bill, he vetoed it. We passed the bill, he vetoed it. We're going to pass the bill again, and we need to make sure we override that veto. We need your help. So by standing up and showing up, now you've got to do the rest of the job. You've got to finish it. You've got to show up everywhere and make sure that your friends and your circle of people throughout this state get the message to the rest of the legislature. When he vetoes it again because of his personal ideology, we're going to override it with your help. Thank you.
Well, isn't it great to see this assembly today? I'm very proud to stand here in solidarity with you as you petition this government to do what's right. Now think about the ideology that's driving this, because as you've heard, this is not about the money. We're talking about a few $1 million in a budget that's billions. We're talking about bringing in federal dollars to deal with this. And I am, being from Burlington County, and as a practicing physician, I can tell you, I've had 2 centers in my county closed, in Pemberton Township and West Hampton. It's wrong for the people of Burlington County. And because I work in a clinic and teach residents there, I see day in and day out the ravages, the many crises that occur every day when women don't get the health care they need when they need it. You delay preventative services. When you delay the exams that you need to find the early cancer, whether it be in the breast or in the cervix, you consign someone to an early death. And that is absolutely wrong. And just think about the ideology that drives that. This governor has cut funding repeatedly for people who have AIDS, who need drugs to save their life. People with AIDS today can live out their life almost as long as anybody else if they get the drugs they need. And this governor, time and time again, has cut that. Think about what that means. This governor is cutting to the bone the healthcare services that affect the poor, the most needy in our community. Now we are blessed to live in a wealthy state. Why can't we share some of those blessings with those who are less fortunate to make sure they get the health care they need? This is an ideology that drives it. This is not to do anything with finance. This is an ideology. And the question for those of us here, we're standing here in solidarity with the women today, day in and day out, we have to say no to that kind of ideology. It's not right for New Jersey. We have to reject it. And what you're doing is helping that to happen. Now, you don't have a problem with the Democrats on this dais. You don't have a problem with the Democrats who sit in this legislature. The problem is with those Republicans in this legislature that walk in lockstep with everything this governor says. We put these bills up. Some people voted for those bills when they first up, and then they were told to vote against them when we wanted to override them because they don't have independence. And the question is, do you want legislators who are not independent and go up there and make decisions on behalf of you? Make decisions on behalf of what's right. Yes. On behalf of what's right. Now, I don't know anybody out there who's got a wit in their head who would say that it's not right for people to get preventive care when they need it. It's not right for the poor to suffer while the wealthy can whistle off on vacation and do everything they need to do. That's not right in a society that cares. It's not right. And so your efforts here are important, but I will tell you, you've got to go talk to those Republicans. You've got to tell them to stand up for what's right. We're doing it on our side of the aisle. Let's get these Republicans to stand up for what's right. We're going to put these bills up again, as you've heard. We're going to go for an override when he vetoes it. And we need the Republicans in the House and in the Assembly and in the Senate to stand with what's right. To stand with you, to stand with Democrats and say no to this government, this right-wing agenda. Let's get the health care that women need and stop this nonsense. It's not good for New Jersey and certainly not good for the middle class and those in need. Thank you very much.
Thank you. We've had a great group of women at the core that have been arm to arm, and I'm so proud of the women that I've been able to work with in the state legislature, and a couple of them are here right now. And I want to bring up Assemblywoman Valerie Vainieri Huttle.
You know what, ladies and gentlemen? We have women in the legislature, and we should appeal to those women that for whatever reason, whether it's ideological, because we know it's not financial or fiscal responsibility, but those are the women, our colleagues on both sides of the aisle, because it certainly is not a partisan issue. It transcends to all of us. And you know what? I look back over the year when we started this advocacy and fight against the war on women, and I would love to say that, you know, what a difference a year makes in a positive note, but quite frankly, I hate to tell you that in the last year with the Medicaid waiver proposals, with those cuts, 93,000 extra people will have no health insurance. And I also hate to tell you that with family care, those becoming ineligible now, there's another 19,000 on the rolls of ineligibility. Where is that extra 100,000 people, mostly women and children, going to go? I don't know. So therefore, we need to keep our Planned Parenthoods open. We need to keep our women's health centers open for those new 100,000 people off the rolls that are getting cut. With the Medicaid proposal, you have to have a family of 3 earning $5,000 to be eligible for Medicaid. I almost want to say in Bergen County you can't do that, but guess what, ladies and gentlemen? Nowhere in the world can you do that, unfortunately. Certainly not in the state of New Jersey. $5,000 to be eligible. How disgraceful is that? I just want to end on a quote, and you'll be surprised who said it. It's from a Republican former, well, let me say it first, and you might guess. Women's health should not be held hostage by ideology or propaganda. The health of American women, preventing unintended pregnancies, and supporting sound family planning are goals that all of us, irrespective of political persuasion, should support. Not surprisingly, it turns out that what is good for women's health is also good for our pocketbooks. And that was quoted by Governor Christie Whitman. Thank you.
I came here today with my staff, and I didn't have a meeting today. I came here today to stand with you in providing access for women's health. In other words, I'm doing the right thing. Let me also tell you this. I am a retired educator. Imagine that. But when I taught a lesson, I always knew that if I had a concept out there, that I had to have examples. So I'm going to take this concept of access for women's health, to have that availability, and what is my example? Saturday I met a woman. She was in her early 50s. Her husband died a few years ago. She lost her job. She lost her insurance. She has a job right now. Her job is in emergency services. She goes out there and saves our lives, all of our lives. Doesn't matter what your income is. Doesn't matter what your gender is. She's saving our lives. She makes $18 an hour. She has no health insurance. She needed to go to Planned Parenthood, and she did. And she got her PAPS test, and she scheduled her mammography, and she's going to get it done. Those are the people that we are talking about. There are people that are slipping through the cracks. They need health care. You know, we go back to what our president has said. Health care is a right. It is not a privilege. So we need you to spread that word and just simply say to people, it's the right thing to do. If I have health care, and I do, I want everybody to have it. Thank you very much.